Hi everyone. In today's video, we're going to talk about how to keep your gastrointestinal tract healthier and make it easier to go to the toilet. Coming up. Hi everyone. This is Ernesto from AttaBoyCowBoy, and on this channel, we give you health and wealth tips to help you be more successful. Now today I want to talk about one of the most common problems that I hear patients asking me about is how they can go to the restroom easier. There are several factors that affect that. The first one is diet. If you're eating a diet that's high in protein like animal meats and low in fiber like oatmeal, buckwheat, whole grains, stuff like that, it's going to make it harder to go to the bathroom. And also if you eat a lot of processed foods. Something that comes to mind is when you eat a piece of white bread, if you've ever noticed, it gets stuck to the roof of your mouth and you have to get your finger and scrape it out. Well, that same issue is what happens inside of your intestines. It gets stuck in there. So it makes it harder for everything else to get pushed through. Now, when you eat buckwheat or oatmeal or something that's like scratchy, it's a lot easier to get pushed through your system. So it's going to make it easier to go to the restroom. The other thing is fluid intake. Now, if you're not drinking enough fluids, you're going to get dehydrated. And what happens is your body uses your intestines as kind of like a canteen. It uses it to store water for when you get dehydrated or you get low on fluids. And what it does is those intestines will actually plump up with liquid. And when you're low on fluid, your body will start sucking liquid out of it, and the intestines will actually constrict. The issue is that as it constricts, it makes it harder for the stools to pass through your intestinal tract. So you want to make sure you're drinking plenty of water, at least 8 to 12 glasses a day. And when you wake up in the morning, when your stomach's empty, drink about 3 or 4 glasses on an empty stomach every morning. That's going to help push things through your system. It's really effective. The third item is medications. Sometimes you're taking pain medications or some other type of medication that's going to make it harder to go to the restroom. Well, ask your doctor to give you something to counteract it, or you can try a natural alternative like senna leaves. Senna leaves are very effective in helping you go to the restroom. And obviously eating a balanced diet, eating lots of fruits and vegetables. So you get lots of fiber to push everything down, and less processed foods and less meats. So you can go to the restroom easier. The fourth item that's going to effective is your activity level. Now, when you're active, your blood's flowing, your muscles are contracting, and when your muscles are contracting, blood's flowing, and nutrients are flowing, and oxygen's flowing. Everything's going through your body. But if you're hanging out on the couch watching Netflix or not doing a lot of activity, you're not going to have a lot of movement of bodily fluids. So it's also going to cause things to get stuck in your intestines. So it's not going to be as easy for you to go to the restroom. So that's another thing, is you need to make sure you're getting enough movement. For folks that are in wheelchairs, try to get as much movement as you can, even while in sitting, moving your legs, moving your arms, or if you're in a bed, doing bed exercises, or just try to move as much as you can to help you go to the restroom. Now, what exactly is going on? Well, I want you to think of your intestinal tract as like a water hose, okay? When you're watering your garden and the water hose is nice and straight, it's easier for you to water your plants, wash your car, do whatever you want. But as soon as you turn a corner or you hit a rock or something like that, you're going to notice a kink in the water hose and the water flow is going to go way down. There's not going to be much getting through. It's sort of the same thing with your intestinal tract. Remember, your intestinal tract's really long. It's several miles long. So if you get a kink in it, it's going to make it harder for stools to get through there. So when you're going to the restroom, you want to make sure that you unkink it. Now, something cool that I saw when I was in Southeast Asia and the Middle East is that folks over there use squatting pans. It's kind of like a toilet that has a hole in the floor. As you can see here in this picture, it's a little bit different from our Western toilets. Now, these folks actually have it better than we do. They're doing things right because these toilets make it easier for you to go to the toilet. By squatting down like that, you're actually increasing the anorectal angle and making it easier for things to move out of your intestines. When you sit on the toilet, it's actually harder. But for us, it's a lot more comfortable because we're used to it. So What I would suggest is getting the best of both worlds. Get yourself a stool. They sell these stools at stores for kids to go on the toilet so you can increase the height. And I've been using these for years. I recommend them to patients, and many times some of my patients have had their issues resolved by simply using these toilets. Oftentimes, my patients have been able to resolve their problems by using these stools. It increases the anal-rectal angle and makes it a straight chute so that the stools can move right through your body and into the toilet. That's going to make things a lot easier for you. Now, what are some of the most common issues with having difficulty with going to the restroom? First is hemorrhoids. Now, if you've ever heard of hemorrhoids are kind of like varicose veins that you get in your legs. It's an incompetent vein. So the way veins work is your heart pumps and relaxes, pumps and relaxes, pumps and relaxes. So what your veins have, they have one-way valves. They go like this. As your heart pumps blood, they open up and allow blood through. And as the heart relaxes, the valves close, and that prevents a backflow of blood. So it's very effective for keeping things moving through your body. But the problem is that sometimes because you're standing too long, you cross your legs a lot, or you have some type of other health issue, those valves become flappy and incompetent. So they flap both ways, and it allows blood to actually pool in there. That pooling gives you that purple and green colored vein that you see in your grandma's legs or maybe even in your legs. So that same thing is happening in your rectum when you have hemorrhoids. The problem is that when you're having problems going to the restroom and you're straining and you're pushing, it puts a lot of pressure on it. So that pressure will actually tear those veins, and it'll cause what they call hemorrhoid flare-ups, where you get blood coming out and it's very painful and it burns. And actually get infected and you can get really bad infections. So that's one of the most common problems. Another issue is anal fissures. Anal fissures are basically tears. When you're struggling to go to the restroom because you haven't had enough water, you're not eating enough fiber, your body's stressing to try to push that stool through. Kind of like when you're trying to scrape that white bread off the top of your mouth. It gets stuck in there. So when you're pushing like that, it causes a strain and it actually tears the tissue. And that obviously causes the same problems I mentioned before, infections, bloody stools, etc. Another common one is diverticulitis. That's very common. That's actually a pocketing in the intestines. Now, one of my friends, Steven, was actually asking me about this recently. He had a lot of these pocketings in his stools, and it causes things to catch and get stuck in your intestines. And again, you get a lot of the same symptoms. It's very painful, you get blood, it's hard to go to the bathroom. And if you don't care for these issues I mentioned, it can turn into colorectal cancer. And that's obviously a lot worse. You can die from that. So an easy way to avoid all this stuff is obviously drink a lot of water, eat a healthy diet, get some exercise. But the fourth one is to use one of these stools with your traditional Western toilet. That's going to make things a lot easier for you. You're not going to be straining as much, and it's going to push things out so you can get all the toxins out of your body. Again, remember, stools have all the toxins from your body. It's all collecting, and your body shoots it out. So the faster you can get that out of your body, the better. You're going to be healthier. Your skin's going to be clear. It's going to make your overall health a lot better. Now, oftentimes when I talk to patients, they'll tell me, wow, doc, I go once a week, or I go every 3 days, or every 2 days. You know, that's not good. Although it's very common, you want to go once a day. If you can, go multiple times a day. That's ideal. Now, I want you to listen for a second. Those are flocks of conures. They're South American conures. They're parrots. And I'm filming today from the Huntington Library in San Marino, California. It's one of my favorite places. As you can see this awesome building behind me. This place is acres and acres. It's huge. And there's conures everywhere. So the conures are flying all overhead here and making all sorts of noise. It's a really beautiful place to spend the day if you're ever in Los Angeles. So again, back to the squatting pan or the bench. If you use that bench under your toilet to increase the rectal angle, what's going to happen is it's going to cut the time that you need to go to the restroom in half. In fact, research has shown that people that use squat pants go to the restroom with half the effort and in half the time. So it's going to be a lot less draining if you have hemorrhoids or any other type of issue like that. It's going to make it a lot easier for you. So again, if you have any questions regarding this, feel free to comment below and I'm happy to answer all your questions for you. This is a really common problem for people, and a lot of people overlook it, and it leads to some serious health issues. So the better you're able to address it, the better off your health is going to be in general. Thank you again for listening, and if you haven't already, please subscribe to our channel. Thank you.